And so we just wanted to acknowledge their contributions and also thank you for the opportunity to partner with you to bring these medicines to your patients.
Conference is being recorded.
And as indicated by the Zoom, this will be recorded, and so keep that in mind. And please don't be shy and turn on your camera because we'll have ours on and it can make it a little bit more personal. As this overall pandemic has progressed, we have also had to continue business and learn how to work in the new normal. And one thing we wanted to try and experiment with was finding new ways to interact with you, our customers and our partners. And we realized that we wanted to bring something a little bit different to the table. And so we were discussing internally and with some of our partners, and it came across that perhaps we could share a third-party perspective, joining together a consulting firm and a large CDMO. And we thought that this was an interesting thing to experiment with. And this is just an experiment, so let us know how you think it went and whether it was worth your time and whether you want to do more of these and we can then do more such ones. Or if there's ways we can make it better, because this is really all about you. And we realized the last thing many people want to do is just kind of get talked at. And so we've really worked with McKinsey, and there are polls throughout this where we want your opinion. And after each of those polls, we have room to have a bit of a discussion if you want. And at the end, we can have a further discussion. We're going to try and keep it tight in terms of the overall time and the respecting of your time. But if you do have something you want to say, I would suggest you, at the right point in time, we can try and make it interactive and see how that goes. But at a minimum, please do participate in the polls and let us know how it goes. And without further ado, if we could advance to the next slide, we could introduce some of our partners at McKinsey who are going to be joining us. The next slide describes a little bit of their backgrounds. But we have Anu and Parag and also Satya, who will be sharing with us different portions of their perspective on the pandemic and how it affects us and what others are doing and what we are doing. So I guess that's the background, and I guess over to our partners from McKinsey.
Thanks, Peter. With that, I think without any further ado, I would just probably request Anu to take us through the first section, which is around COVID-19 and its broader implications that we see globally happening and some of the learnings that are emerging. Over to you, Anu.
Yeah, thanks, Saptarishi. Thanks, Peter, for kicking us off on this. I think the first and most important reflection to keep in mind really is that this is obviously an unprecedented human challenge, right? Crisis challenge, huge human ramifications, regardless of which domain or role for ourselves as human beings, we envisage. And therefore, I think the point around companies around the world need to act promptly assumes a much greater meaning and significance. And much as Peter mentioned, the sense of purpose that companies must and can adopt at this point in time provides a very, very helpful foundation to thinking about how to respond to the crisis in terms of how to really help all stakeholders cope with this and come out better and stronger. So with that, if we just move sort of to the next page, in more kind of, if you think about the twin goals, right, for an economy, a community, a business segment, there really are these two twin goals or two twin curves that we are trying to manage and optimize. The first is how to safeguard our lives. And then the second is really all about livelihoods. So it's a delicate dance between the two, but we can't sort of underemphasize the importance of either. And therefore the curve on top is all about the health outcomes and how to really contain and suppress the virus and expand management capacity on the health side. And then equally important is this, economy curve because of its impact clearly on getting people back to work, getting livelihoods back on track, and planning for a more healthy and robust recovery. We'll focus the first part of the comments here around the curve on the bottom, which is really the livelihoods and economy curve. And we all recognize that there's a huge amount of uncertainty around this. So in that spirit, on the next page, we really think about economic outcomes as a set of scenarios, as opposed to being predictive about any one particular path. And we're also going to get into trying to gauge, even in this room, where the sentiment lies across these scenarios. But the way we think about the economic scenarios is there are uncertainties on two dimensions. On the vertical dimension, there is genuine uncertainty about the spread of the virus and how robustly it or confidently and certainly it can be contained. You could have a 2 to 3 month rapid containment phase that some countries like China have actually seen, relatively strong containment there. But on the other hand, you could have regional resurgence. So the virus flaring up and needing a continuous process of locking down and restarting the economy with all of its associated disruptions, or then a broader failure, right, which we're hoping we won't get to. That's one axis. The other axis of uncertainty is actually how effective economic policy responses, stimulus packages, bailouts for sectors, support to the financial system to prevent large-scale collapse, and of course, stimulus checks and other forms of supporting vulnerable households. How effective will these be? That again is something that we are still to see, and that adds the second dimension of uncertainty. Now, we focus for the most part on the scenarios called A1 and A3. A1 is in the middle of this grid, so it acknowledges that there are parts of the world which will go through a virus resurgence with uncertainties associated with that, and that interventions might be only partially effective in managing the economic consequences. A3 is a slightly more optimistic scenario on the health side, but equally acknowledge the policy uncertainties. Of course, the field is open and we continuously evolve points of view around the grid, but we really focus on A1 and A3. So as we've done this work around scenario building for multiple countries around the world, this is the sort of aggregated view that comes out as we look at the two scenarios I mentioned. And this is a busy chart, so let me draw your eye. First, let me explain what the graphic means. This is essentially quarterly GDP estimates, which are all indexed to the October-December quarter of 2019. And then from that indexed value of 100, we see what the dip is and what the trajectory of potential recovery is under each of these two scenarios. Now, on the left-hand side in the A1 scenario, where we said there was a strong likelihood of virus recurrence and therefore a muted recovery, if you look at the table at the bottom of the page, you look at the world economy line, and here we see that there could be a drop of about 11% in terms of GDP for the quarter, but even for the whole calendar year 2020, this would be a negative 8% or thereabouts of a GDP contraction. And then the world economy would come back to where it was pre-crisis only towards the end of 2022. And there's obviously a variation between China and then the US and the Eurozone. China sees a more muted contraction, but nevertheless, it is a contraction which is pretty severe for China. But the US and the Eurozone would see a much more severe contraction in 2020. So that's A1. In A3, on the right-hand side, under a picture of perhaps, progress on the vaccine front or better containment of the virus overall, we would still see for the world a full year drop of about 3.5%, negative GDP growth of 3.5%. But with the recovery by early to mid 2021. So it's a much steeper bounce back, if you will. And then again, China would be roughly neutral for the year. The US and the EU would actually see some negative growth. The jury is out about which of these scenarios will pan out. The reality may be different parts of the world progress at different paces and not everything pans out in the same sort of integrated scenario, so to speak. But it serves to, I think, point out that either which way, the 2020 contraction is quite steep. And then there is uncertainty about how fast the bounce back can be. On the next page, I think we are actually asking for a dipstick of sentiment in the room itself, right? Around which of these, according to you, is most likely to pan out. I think there's a poll EV that actually will help respond. It would be fascinating to see. And then we can also share what similar dipsticks around the world have also shown.
I would request the participants if they can open the link that they see on the top left of the slide, which is pollev.com/Piramal, and vote on what is the most likely scenario that is going to pan out according to them.
If people are having difficulty accessing the poll, please write on private chat and we can try and help you. But we can maybe progress. And I think we maybe, how many responses did we get from the group so far?
It's 13 till now, Peter.
So let's wait another minute and then maybe folks, it does take some time to learn how to switch between the modes.
How many is that now, Saptarshi? Gautam?
It's 15.
15. Let's beam up the responses again. Well, I mean, I think, clearly where people are merits a longer discussion. But let me sort of share, I think these numbers are moving now quite rapidly. So obviously people are managing to respond, but it's quite interesting because when we ran this similar poll globally to about 2,000 senior executives in different parts of the world, I think the weight that the A1 scenario, bang in the middle, attracted was actually quite similar. It was about 33 to 35%. And the sentiment had actually converged towards A1 over the last 2 or 3 months, right? So you had outliers who were a little more optimistic earlier, but that has converged back to saying A1, and that globally was about 33%. And the next most favored scenario was indeed, it's surprising that it's B4 in this case, which is significantly more grim. The global sentiment had actually voted for A3 at about 20% as being the next most significant weight. But the sentiment here looks more negative than that. So that's interesting and might well reflect some of the geographies that that people are thinking about. Okay, so should we move on, having got this, Peter? Yeah.
And it's interesting, this is an observation in the spirit of a discussion. Perhaps, at least the one we saw in the earlier presentation was an older poll, and I think the reemergence of the first wave in some geographies has perhaps not been what people hoped for. And we may have a different geographic mix from your poll. And then finally, perhaps the pharma audience may be different than the industry agnostic audience. Those are three possible reasons.
Spot on, absolutely on all three. I think more well-informed certainly about the health aspects of the crisis. And yes, it's also true that the earlier poll was the end of June. So a few weeks are like a lifetime, right, in this current situation that we're in. So that can swing this as well. Okay, so I guess whichever scenario we vote for, the unfortunate truth is that if you adopt a really long-term horizon and look back in time, most of these scenarios are actually worse than anything we've seen for the last 50 to 70 years. And the depth of the drop, I think, is only mirrored by World War II and prior to that, the Great Depression. But otherwise, this is true for every single country in the world, that the depth is something that most corporate leaders, business leaders, most politicians for that matter, have not really personally seen anything like this. The global financial crisis is actually dwarfed in comparison to this, because the kind of effect this is having on day-to-day lives is significantly more and different than anything we've seen in the past. So that said, I think there is a question around, so what happens and what of this really sticks and shapes and reshapes the world to come if you adopt a longer term view going forward, right? And the jury is still out on many of these, the stickiness of these impacts on the so-called structural forces shaping the world. But for argument's sake, I think there are a set of structural forces which are getting accelerated at a pace, and where different stakeholders are actually realizing value from the acceleration. And it's very likely that these will stick. And I would put a lot of the digitization and automation adoption that we're seeing in businesses, in the way we serve customers. Telemedicine is a great example of potentially a win-win, where all stakeholders in the system really do want it, but it never happened for whatever reason. It just wasn't pressing for it to happen. So similarly, the growth of digital ecosystems and more remote work, though not to the extent that people like us might imagine. For us, the future of work can be remote, but for 40 to 50% of the workforce, that's actually not the case. But nevertheless, this is an acceleration of a trend that was already happening. Some of the trends that we see perhaps might not stick. So the stuff we put in the temporary bucket, of course, energy prices are soft in every crisis, but it's possible that they can rebound. And then urbanization is an interesting one. What will be the densification effects of COVID is a real question. We are seeing in countries like India, we saw the first wave of reverse urbanization and reverse migration was very strong. But then there is a very strong, relentless logic of the fact that cities do offer better work opportunities and higher productivity work for everybody. And so this might well be a temporary phenomenon that reverses. There are some trends which have changed a bit in nature. So the pattern of globalization, at least temporarily and for the longer term, might be different. A continued strong focus on globalization of data and services. For different reasons, a shifting pattern of globalization in terms of goods trade, but perhaps a little lower in terms of migration and people. The superstars point I will come back to, but the simple point here is that the ability of the leaders in the pack, the strongest brands, the most capital efficient platforms and so on, their ability to really pull value away from the rest, that is probably intensifying. And then a question mark on some of the others like sustainability. There are mixed signals. Some stimulus packages are linking money to it, whereas in other places it's kind of retreating a little bit because the urgency of the green agenda is perceived as less than the urgency of getting growth back on track. Finally, in the new trends, I think resilience in supply chains is clearly coming out through multiple CEO feedbacks globally, that it's not just the efficiency and cost effectiveness of the supply chain, but also its resilience from a risk management point of view. This has become high priority, could mean many opportunities for manufacturers in emerging economies. The speed and scale of innovation we all know about. And finally, government involvement, which structurally over much of the developed world at least had been in a way on a decline in terms of government intervention. Government involvement is likely to actually rise up again, along with stimulus spending and all of the measures that are being taken. So this is just a sort of short, 100,000 foot level of some of view of some of these trends and how they could stick. But before moving into the more specific part of today's discussion, I think there's one last chart that I'd like to really show you, which underscores the point around the superstars. And Gautam, if you could flip to that section, I will just talk through that one page. So this is essentially the trend and change in market capitalization, right? For at an industry level. The blue bars really show what happened from the beginning of the crisis all the way till March, the end of March. But then the black portion is what remained as of the end of July, right? So what this tells you is that initially there was a very stark sort of pulling away or a variation in terms of the way markets perceive different sectors, the ones most hit by COVID on the left-hand side, which of course include travel and then banking and insurance and luxury retail, real estate as well. Whereas the right-hand side, the more non-discretionary consumer services, tech, healthcare, pharma, all of them rose in value. Now, some of that polarization has been corrected, but nevertheless, I think it's a fairly stark polarization across these. And what's really interesting is that even when you look within each of these industries or sectors, what you find is that the companies that are the most efficient in terms of economic profit creation, so they use capital really well, those are the companies that have actually pulled away from the pack. Again, this is much more stark in this crisis than it was at the time of the global financial crisis back in 2008-9. And therefore, those who are able to sort of adapt, are on the right side of this curve, could actually see more enduring opportunities to create longer term value for all stakeholders than we might have imagined in the past. Let me pause there, and I don't know if we should take questions at this point. Saptarishi, you should guide us about how we go forward.
Yeah, if there are any immediate questions, sorry. Okay, Pastor, if there are any immediate questions, then you can take it, or maybe we can just cover the next section, and towards the end of the section there is the polling, and after that you can take additional questions.
I think in the spirit of getting through the material, if people have questions, please try and use the chat feature, and we can try and use that to kind of focus some questions at the end and get them answered. Thank you. That was a great macro overview.
Sure, Peter. Thanks, Anu. And with that, if you can request Satya just to talk to the next.
Yeah, no, good evening, everyone, and good morning and good afternoon for those of you in different parts of the world. It's a privilege to be over here to share what we believe are the changes in the pharma industry more broadly. I think the shortest sign that there is a change, by the way, is the fact that we're addressing an August group like all of you sitting in a t-shirt out of home. So that's the first sign that things are changing. But on a more serious note on the industry itself, we wanted to start with a little bit of a framework slide that explains how we think about disruption. And we think COVID has brought it into sharp focus. If you look at the two axes, we're basically saying, when we plotted all the industries that we are working across as McKinsey, we said, what is the extent of the business model disruption? So there are disruptions in industries like hospitality and travel that are shaping a whole new business. They're actually pivoting away from what they used to do to entirely new business models. And that is what you see on the right-hand side top corner, right? But, and of course, there are a bunch of businesses pretty much like consumer CPG, for example, which is left-hand side bottom corner, which is really sustain your supply chain, sustain your markets, making sure that your products are out there and getting sold. But fundamentally, along with the little tweaks of digital along the supply chain and sales, is more or less sustaining your business model. But pharma is one of those unique sectors, and it depends on which part of the segment you're playing in, that spans what I would call segments 2 and 3. First is, I think there are companies that are fundamentally restructuring. There are companies that are thinking about delayering. There are companies that are thinking about reshoring. There are companies that are thinking about variabilizing fixed expenses for them. So you'll see a lot more offshoring. There are companies that are thinking of shutting down service lines and growing others, right? So there's a fundamental restructuring there. And there is also a big shift on the business model. There's a big shift in the business model in terms of how operations are going to be done. There are conversations on contactless supply chains, on hands-off-the-wheel analytics-driven S&OP processes. But there are also question marks on how we will engage with HCPs right now. Is the old model of engaging with an HCP where you go meet a doctor the right one, and is that the one that's going to be welcome? And we're noticing, by the way, that there are 6 or 7 segments of HCPs and how they're going to interact with you. There are those who are saying COVID is a V-shaped event, everything goes back to normal. There are those who are saying, I'm done with meeting all your reps, let's move it to completely virtual. So there are all kinds of those models. We're also seeing pharma restructure their business model to adapt to the current normal. But to ground this in what exactly is happening, Gautam, if you can move us forward by one slide. We're seeing several trends play out. I think first is we're seeing increased government involvement. A lot of people have asked us, government spend as a percentage of GDP, it is what it is. Do you see changes? Do you see quasi-government institutions playing a role? I think we're saying 3 things. I think first is there are programs to reduce the burden on companies. That's obviously visible and that's happening. There are scientists looking to field trials, qualify new treatments, therapies. There's a coronavirus treatment acceleration program that's been announced. So there is an increased role in government, but I think more specifically, there is going to be changes in how the government looks at healthcare, which we're unable to plot at this point. And I think that's going to evolve. Are they going to play more of a role, which is interventionist in public health? So that's a space that we need to continue to watch. The second is an increased focus on supply chain and risk management, which I think comes from an increased emphasis on mitigating risk in the supply chain, even if it is at a higher cost. And I think this is a conversation for now. No changes have happened, but we all know that the conversations around, is it better to be nearshore? Is it better to be diverse and diversify risk across multiple sources? Increased collaborations and joint ventures to de-risk. Several of that noise and narrative is playing out on the supply chain side. There's a focus on portfolio rationalization and harmonization. I think people have focused a lot more on the top SKUs. Demand planning has been reorganized. I think there's a view saying that production scheduling to ensure higher utilization of limited resources is a big push. And therefore, let's decomplex our organization, let go of the SKUs that don't make money for us. The fourth is new horizons and efficiencies. I think there's a big one saying, can we now zero base everything and think about opportunities that we never thought were possible in the past? And this is the time to zero base it. So whether it's cost, whether it's relentless prioritization of production plans, whether it's imagining whether you still need the old network, are question marks that we're all asking ourselves right now. Increased utilization of data and decision making. I think we found, surprisingly, that business leaders have relied less on intuition during this environment, and actually have tried to find as much data as possible to make those decisions. So whether it's stocking decisions, inventory, how do you qualify a new supplier, changes to production scheduling, we've seen a more rigorous approach to how companies are thinking about their architecture and governance, which is an interesting theme that we think is going to play out and is probably here to stay. Increased innovation in clinical trials. I think there's disruption in ongoing clinical trials simply because of what's available right now. But I think through a combination of digital and quick win solutions like remote home engagement, in-home nurse visits, shipping investigational medicine products directly to patients, some of those innovations are also speeding up how we address clinical trials. And the last one was something I alluded to in the previous slide, which is there are new models for customer engagement. Needless to say, it's the buzzword to say we're using digital a lot more. But there are innovations in how digital is working. I think a lot of doctors have come back and said, digital is great, but I don't want another app on my phone. So to the extent that you have a web service that provides a service, we're okay. So lots of segments and innovations in how we're modeling ourselves for customer engagement. But CME is constant medical education, actually getting credits for technical accreditation has moved online. And I think that's going to continue to evolve as this lockdown and this period of uncertainty continues. More and more models of customer and the customer's customer is evolving. Gautam, if you can hit the next slide and then we can maybe pause to take a few questions. What are the potential implications for the pharma industry? I think there is first, which is let's find a way to ensure resilience in supply chain, whether that's market-backed network strategy, whether that's sourcing, resilience in warehouse capacity, inventories, contingency planning. The second is we think digital and analytics is here to stay to enable the organization. We believe through a combination of digital and analytics with a huge cost takeout, whether that's because of early warning systems, whether that's because of certain redundancies that we're able to better deploy technology for, we will be able to do that. Third is an upskilling or multi-skilling of the workforce. We're working on plants now with smaller capacities in very many situations. And can those capacities handle more functions? They're not going to be able to do it on their own. We need to multi-skill. So how do we actually upskill and multi-skill our workforce? We're seeing a lot of partnership and inorganic moves, A, driven by a lot of people who are willing to spend, but also B, by a lot of people who are now deal seeking. Willing to sell, and a lot of people who are also now deal seeking. So we've seen just in the India and contract manufacturing space, several deals that have consummated in the last 12 months. We're actually likely to see that accelerate quite significantly going forward. And lastly, I think there is something around faster and agile organizations. All of us are probably feeling that we're working more intensely now after the lockdown has started. I think it's a combination of remote working, combination of intrusion into private space, combination of travel time going away, combination of people getting more acclimatized to home working and eliminating non-value added activities. This is going to define and create a faster and more agile organization. The question is, are we going to just increase that into activity, or are we going to channelize that into something productive? So those are 4 or 5 implications that we're seeing for pharma industries, and several of them are things that pharma companies have tapped on. But I think there is a big shift now from knowing about it to acting on it to making it impactful, which is, I think, the journey that we're going to see over the next 6 to 12 months. Before we pause, Gautam, I think had one question to ask all of you, just to get a reaction on what you're seeing as well. Gautam, do you want to move to the next slide? This is a little bit of the PolyV continuation that we want to do, but we want to get a sense and a pulse from you, and starting with the most important to what you think is least important. What are the implications for the pharma industry from the COVID-19 crisis? We can maybe take a minute and get a few responses just to get a pulse of the room. Before, Peter, if you're okay, maybe just pause and take questions and reactions from everyone across section 1 and section 2.
If I may request the participants to log on to the same link. If you just refresh your previous page also, you should be able to see this question now.
No, thank you for that. It's consistent with I guess what I would guess if I was to hazard one. I'm conscious of time, and we have a deep dive into one of these chapters over the next 20 minutes, but maybe for the next 3 minutes, we can maybe just invite some responses. Otherwise, we can move to the next section. Does anyone have anything to share?
If anyone would like to be bold and ask a question, please unmute yourself, and we'd love to hear it.
And David, just to confirm, people can unmute themselves, right, if they're not co-hosts?
They can indeed, yes.
So if ensuring supplier resilience is the number one, how do you deal with that challenge if you're not a DNA-enabled organization, to make sure you can do some of these things virtually, to identify, audit, do other things to be part of a supply network? How do you find new partners if you can't actually visit them face to face? What are the tools? That's going to be a challenge for everybody.
That's very true, Stu. Very true. And I don't think we figured it out, right? So it's part of the journey that we're all going to learn, including how audits are going to happen in this kind of an environment.
I think if I can interject, Satya, this is Parag. I'm going to be talking about supply resilience in a minute anyway. I think, Stuart, it's a spot on observation. And as Satya said, that's why we believe DNA is quote unquote here to stay. In fact, I think there's a significant acceleration that's going to happen in the industry. We're already seeing lots of remote ways of working for our indirect employees and our direct employees. And I think things like auditing and others will continue to need to happen. And given the uncertainty that's here for at least the next year, it's going to accelerate that advancement. So you're absolutely right in order for that to work well.
Okay. Parag, if you're okay, shall we move to the section that's clearly ranked number 1?
Yes.
We promise you we didn't rig that poll. We just did expect that supply resilience was going to be the most interesting topic.
Yeah.
So on that note, maybe I can hand over to my colleague.
Yeah, perfect. Yeah, this has been a hot topic for many, so not too surprising, but good to see it's consistent. So maybe Gautam, if we go to the next page, I thought I'd start by a bit of context. This topic and idea of supply chain strategy and thinking through what to do has been not just a COVID issue. It's been longstanding for a while. We actually conducted a broad survey across industries late last year, and we saw very similar things, right? The large majority of the world business leaders expect significant change in globalization and sourcing strategies. So this is a big thing they see coming anyway. And lots of folks intend to invest more in supply chain technologies, and they see that happening. And I'd say a bit more muted pre-COVID on whether operations should move closer to end consumers or not, and whether you need to diversify across countries. And I think what you see as you go to the next page, as we dive deeper a little bit, that is a lot of that is progressed, right? So this idea of proximity to consumer and diversification, I think is squarely falling into the idea of supply chain resilience. And a large component of the folks we surveyed more recently, post the onset of the COVID pandemic, see that becoming a bigger issue, and they're planning against how they deal with that. And it's multiple factors. It's dual sourcing, it's inventory, it's regionalization, et cetera. And they see also a shift in how they do day-to-day supply chain planning, as well as supply chain talent they need to bring in-house and what that means. It doesn't mean bringing new employees, but perhaps reskilling the workforce to be able to take advantage of advancements in technology, as well as a new way and a more rapid pace and agile approach to supply chain resilience. So if we go to the next page real quick, I think I want to start a bit broader, and I think we'll dive a bit deeper on one of the topics we've heard a lot of questions around, but certainly in the question portion, if there's topics others, let us know. But I'd say multiple themes we've seen across this. There's been many disruptions, many of which we've talked about, and you've probably all lived and breathed over the last many months. But disruptions as regions shut down, and as it started in Asia and kind of cascaded to the rest of the world, a shift in consumer demand, the workforce and consumer health transmission concerns, and significant government interventions either that happened in flight or are likely to happen moving forward. And I think what that's done is led to a bunch of themes that have emerged on what long-term supply chain resilience means. The first of which I'll talk about in a bit more depth, but the idea of reshoring and or nearshoring your supply networks and manufacturing operations and resultant talent. The idea of multi-source networks and inventory optimization. As I mentioned and Satya mentioned, acceleration of end-to-end digitization and advancements of technology. Companies playing a bit more of an active role in their communities and promoting sustainability. That's actually viewed as a net benefit in overall sustainability and resilience. Agile ways of working, and just the idea of de-risking your network and taking advantage of having dedicated risk management functions. Many pharma companies have had this, more the larger companies. What we're expecting and seeing is it's now cascading a bit more broader throughout the industry. So just taking this one notch deeper, and we dove deep a bit, if we go to the next page, on small molecule specifically. Obviously, you could have a similar discussion on other parts of the industry, both large molecule as well as new modalities, but given the audience and the focus, what we see is a couple of things. Primarily pre-COVID, I think you all know, production's concentrated in China and India, especially for APIs, given the low manufacturing cost and complexity. And that was managed pre-COVID. Many dynamics came into play over the last year or so, in particular the last 6 months, right? Export bans, while temporary, had a ripple effect and then raise concerns on what the long-term approach would be. Increasing government and concern from pharma companies and governments on long-term security of a supply chain, the ability to get product from point A to point B in a reliable fashion in a timely manner. And then finally, stretched budgets. This is a big issue, right? The hospital systems are going through massive challenges across the world. And the ability to kind of pay in the same ways is different. And so any reshoring that might happen is a concern. And people see that coming. And that's something that they're trying to grapple with. And so what we see as you project out moving forward is a couple things. And we put this in the context a little bit of CDMO. But you can see PharmaCo's kind of having a bit more favor with CDMOs to enable some of that resiliency. Can they diversify the geographic footprint without building it themselves and creating a strategic partner? And can they create stability in that way? There is a much higher bar that companies are dealing with and grappling with on financial and structural risk assessment. In fact, what we've seen in some of the larger pharma companies, as an example, they're actually going back into tier N, right? So what that means is their primary supplier, the supplier to their suppliers and the suppliers to those suppliers, they're worried about the financial stability. And so they're debating, what do they do? Are there big ones we actually infuse some cash into? Or do we think about organizing that differently? And so that's something that's pivoting over time. And the idea of geographic diversification, as I mentioned, purely as a way of differentiating is becoming a bigger topic. And potential for a production volume to shift between geographies in a 2 to 4 year horizon, right? This idea of globalization, I think somebody in the chat mentioned a while ago, is this going to be a reversal of globalization that happened over the last 20 years? TBD, in my view, but certainly there's some signs that point to perhaps a shift to a bit more regional and local requirements for essential medicines. And I think that pivot could happen based on the roles that various governments play and, quite frankly, the response that the industry is seen to have in this pandemic. So those are just a couple thoughts, at least again for small molecule. If we think about kind of the geographic view, if Gautam, if we go to the next page real quick, this is a bit of the net flows as we think about them, again, small molecule focused. What we see is a bit of moderate acceleration in North America and Europe. a bit of mixed impact in India, and a bit of deceleration in China. And so in our view, there'll be further discussions and movement and likely shift in North America and Europe, given what we just described, the countries and governments' desire to manage this better, and the individuals' companies' desire to be more responsive and agile and resilient. And that has an impact given the pre-COVID structure and the shift that will lead to. So that's just a little bit of a flavor. Obviously, I went through this quickly because I want to make sure we have a little bit of time for discussion. It's interesting. I see the comment in the chat about investments in the likes of Kodak. You're absolutely right. There's been two big investments the U.S. government's made. One in a company called Flow Corporation, which is pushing this idea of continuous manufacturing. And then recently, as of early this week, in Kodak. And so these are both just signals of both the role the government is willing to play in helping de-risk some of the challenges historically that could lead to continued reshoring and or onshoring, but also the idea of companies that haven't historically been in the industry, their desire to get in, because let's face it, the margin profiles have been positive. And so if new companies can get in as a way to diversify their business, and the government's going to help de-risk that, then that could be a bigger impact over time. So if I just go to the next page, and I think this is a bit of the last content page I'll go through. As we think about the implications of this for, what factors drive selection, I'd say there's kind of a couple of big things to think about. And none of these will be overly surprising to any of you, I'd imagine, but there's been a bit of a shift in this in terms of the timeliness and the aggressive look at it. But quality continues to be a big issue. Nothing new there. I think that's something you've all been living and breathing for quite some time. It will continue to be almost table stakes as a purchase criteria. If that's something that you can't figure out, that's going to be a challenge. A new one that's emerged, as I mentioned, is this idea of supply reliability and financial stability. That's always been there. It's always something that's mattered. What we've seen is companies are taking a much sharper look, and they're going further back into the supply chain on how important that is and the scrutiny they give to it. We mentioned the idea of technology and capabilities and cost. Nothing new. If anything, the idea, Stuart, that you raised about how do you deal with some of this without technology. I'd imagine over the next 12 months that will be something they look at more. How capable are you? Can you interact with my business? Can we have more seamless interconnectivity, if you will, between my data systems and yours, so that we can be more strategic partners and work in a different way? So that will likely accelerate. It's always been there, but more of an acceleration. And then I think one other lens that's always been, but I think a different look at it, is capacity. If governments play a role, what role will they play? And how will they require industry to respond? Will they stockpile inventory for themselves? Will they build infrastructure on their own? Or will they require certain companies that have presence in their markets to have capacity reserved? Well, companies do the same to their CDMOs to say, hey, if I need this, I want to be able to call you and I want this switched on immediately. And so what are then the implications and ability for a CDMO to respond to that request of more urgent capacity in the spirit of resiliency? That's a buying factor that I think will become a bigger issue over time. And the last one is this idea of compliance. Again, always been there, but it's being traded off a bit differently with the government involvement in a different way than in the past. So I lay this out as just a thought starter, a couple of things that we're seeing, but I think on the next page, we'd love to hear from you all. Gautam, if we go to that, and if you have the poll still, please refresh it or go back to this website. We'd love to see your thoughts on how you rank order the factors of importance of all of these as with your experience. Maybe just another minute, Gautam, and we can show the results. Somebody struck out the whole page, didn't like the question. All right, should we show it? Okay, insightful and somewhat consistent, right? Quality continues to be an important driver, a bit of the table stakes, and it's very, very important given the role that you all play. Interesting to see that supply reliability and financial stability is as high as it is. It's consistent with what we've been hearing. So good, that's very helpful. I know we only have 5-6 minutes left, so happy to take any questions. You know, I'm sure Anu and Satya and others we can take questions on any of the topics we've covered today, but hopefully you found this useful. Would welcome thoughts as well, not just questions if anyone wants to add their points of view.
A question for the speakers as well as maybe the audience. I mean, the intersection of what we're trying to do in the pharma world with COVID and politics, the political environment, country by country. You know, you talked about globalization, but you see this thing about buy local and the push. You know, even when France talked about hydroxychloroquine and they were going to give it to their own people first if it worked. How is that going to impact what you see in the supply chain?
It's a wonderful question, Stuart. I think it's the answer to that, I think, is it will depend on how aggressive the government gets. I think there was a reactionary measure that happened as the outbreak went on. And so you saw lots of governments, you know, including India and Germany and the US and France, as you said, take a very aggressive stance on certain select products. I think lots of folks governments eased off on that as things got a bit more stable. But I certainly believe that there's going to be some heavy scrutiny that the government agencies look into to say, what do I need to do to ensure at least the essential medicines are available to my patient population in my country? And so from a supply chain standpoint, you know, there's multiple ways to deal with it. Do you manage inventory in a different fashion? And do you prioritize your SKUs and the way you manufacture in a different way? Do you build infrastructure more locally or regionally, depending on your portfolio of business and the markets that are most important to you? And so then do you yourself create either partnerships and or you know, facilities to be able to do that and be more responsive? I think there's multiple levers they can pull. Exactly what gets pulled, I think, will vary by business and by company, and then by the perceived role that government will play. That's my 2 cents worth. I don't want to take away from anyone else that has offers on this.
We also have a question from Dr. Carl Roberts, which came up in the chat, which perhaps you could address, which is any comments from McKinsey on the longer term outcomes of COVID-19 related increases, changes, or otherwise in government and public money funding for R&D?
Satya or Anu, do you want to take a stab at that? I'm happy to share my thoughts as well, but
I think I have to have the humility to say I have no idea. I think I've heard noises that both support that and are against that, right? Is COVID a V-shaped event? It's hard. So I think 2 things are for sure. I think COVID is making the governments think a little bit more on the role that they want to play in healthcare, across provision, across insurance, across support to the industry to provide medicines. But I think on R&D, temporarily for sure to get a vaccine out, including maybe waiving a few phases, supporting the trials. But I think over the medium term, frankly, I have no idea how they're going to respond. I mean, this could stop becoming an issue 6 months from now, and then who knows?
Yeah, yeah, and I would say the same, Satya, at least sitting in the US, which is where I live, I see exactly that. It's unclear how this is going to play out. I do believe right now the government is trying from a vaccine standpoint. I'm sure you all saw the $2 billion investment or commitment to Pfizer for the first 100 million doses for the US patient population, and a commitment to buy 500 million total. That is a way to de-risk that part of the supply chain ultimately. And I think in some ways incents Pfizer to maybe take a bit more risk in getting commercial launch volumes available before perhaps even the clinical trial results are in. And so there's a little bit of that happening in a targeted way. How much that sustains and how aggressive that is anyone's guess, right? In some ways, if this resolves itself faster and the vaccine is available, maybe we go back to more of a market-driven approach and involvement. I think some companies struggle with government investment in general because they say, gosh, am I going to be hogtied in some way to that government if I take that funding? So there's a bit of a yin and a yang to this as well.
Just one data point. We'll let the McKinsey experts comment on the things, but we have one data point from our own inquiries on manufacturing and development related activities in response to COVID. We've probably had more government requests for our services directly procuring capacity or indirectly funding our clients to procure capacity in the last 6 months than we probably have in the last 6 years. Now, we haven't seen that same inflow for non-COVID responses, but in this immediate moment of crisis, we've seen more active government and foundation involvement in this sort of area where typically we would only deal with orders of this size with commercial customers, with private backed funding.
I think, Peter, that this is actually one of those moments or phases in history where, particularly in India, but I guess more broadly around the world as well, the whole nature of public and private engagement can actually improve significantly, just given some of these symbiotic relationships, right? So there is, I think the government is acknowledging at some level that the speed and scale of response and ability to solve big problems in the private sector is actually quite high, certainly in healthcare, but also in, I think, other areas. So we've heard similar openness to, talking to the private sector to solve big problems on the education front, just given online schooling and, online education has become a huge priority. So it could be a temporary feature. We hope not. We hope it can be a more constructive and lasting engagement.
Recognizing we've gone over the time, I do have one more question from anybody, including our panelists. Is there any concern that with a crisis, as Peter laid out, happening with COVID and the amount of money being spent and thrown at it from a variety of places, that there's going to be a shortcut in the efficacy and testing to get something to the patient population that maybe even be unproven?
I'm happy to lean in on that question, Stuart, which I think is a good one as well.
Question, but we all know it takes 12 years to develop a drug, if not longer, and vaccines are tougher. And all of a sudden you got things in phase 3, and then Moderna comes out and says it's going to cost $50, and then you get reactions. So there's a lot of noise that maybe it might be science driven.
Yeah, no, I think we've actually looked at the vaccine development timelines historically, and a few of our colleagues actually just published a white paper that perhaps we can get to a few of you on, a lot of the fact base here, but vaccines of this size and scale historically, if you think about the timeline of when this started in terms of discovery of January, normally it takes at least 5 years to get to anything of reasonable scale, and I'm being very aggressive. So if you look at any of the historical vaccine developments, at least 5 years to have something commercially available. And we're talking about having something available as early as later this year at some dose, let alone at full commercial volumes in next summer. So absolutely, there's a very aggressive approach taken to this. I believe companies are continuing to hold the bar high, as are regulatory agencies, on the testing required and the efficacy. But like any other, uncontrolled disease, I think there's a bit more risk taking that is happening. And so I think that's TBD. So is there a concern? Yeah, I'm sure many have that, and I've certainly heard it. I certainly am more optimistic and hopeful that the bar is kept to where it needs to be, and so that this coming out faster doesn't create another ripple effect for society at large.
Okay. So I'd just like to thank both Piramal and McKinsey for this session. I thought it was interesting. I think we could go a lot longer because it's obviously a topic that's of interest to everybody. Again, this will be recorded. It is recorded, and we'll actually post some links to this. And maybe this leads us to a second webinar to drill down on a couple more topics. But everybody, thank you for your participation, your voting. It's going to be we are in challenging times, and even this technology work, which is a good thing, which is another thing we didn't talk about, because some of this technology fails when we have Zoom overload. Things don't go well. I'm happy to say this went well. So thanks, everybody.
Thank you, everyone, for your time and attention.
Thanks, everyone.
Thank you for having us.
Have a
It
good
was
day.
lovely
Thanks.
interacting.
Yep.
Have a lovely evening.
Take care.
Bye.